Just relax and wiggle your toes for me. There you go. You are all set.
The rate of COVID-19 vaccinations in Wisconsin is climbing as some overall case numbers of the virus are falling. Wisconsin's vaccination rate is now equal to or higher than other Midwestern states, but health officials say they still don't have enough vaccine to meet demand. The government, through the Federal Emergency Management Agency, is looking to create mass vaccination sites in cities across the country. As Upfront's Matt Smith reports, Milwaukee and Madison are hoping to land that FEMA designation.
Still a steady stream of cars this day at the Alliant Energy Center in Madison. COVID-19 testing underway. The vaccinations at the far end of the pavilion already wrapped up for the day.
Right now, if we had an unlimited vaccine supply, we could do just over 1,100 vaccinations a day here.
And what are you currently doing?
Right now we're doing about 400 a day, and that's based completely on vaccine supply.
Dane County is one of a plethora of local governments applying to become a federal vaccination site. Up to 100 nationwide, the Biden administration has said, eventually run by FEMA. What are they looking for in terms of whether approving a site or not?
I think FEMA is also waiting on to see the availability of vaccines right now. We're in contact with them today. We're planning on doing an inspection right here on the grounds again.
Milwaukee is also applying to be a federal site. City and county leaders this past week argued the state's largest municipality isn't receiving enough vaccine.
But we have to make sure, even with a FEMA site, if we are going to be required to use our own supply of vaccines for a FEMA site, does that move us forward?
And that's still the big question. FEMA would bring manpower, allowing county health employees to vaccinate elsewhere. But the vaccine would be the silver bullet, and just the potential for an influx of even more has locals scrambling to grab the attention of the feds.
Ideally, the federally resourced sites would get their vaccine supply directly from the federal government and not from the state allocation. And that would increase the overall amount of vaccine available in the state, and that would be ideal. I'm not sure if anyone knows if that's the actual case yet.
So as for timing, at this point, it's anyone's guess. FEMA has not indicated when it'll make a final decision on these first 100 sites. Adrian?
Matt Smith, thank you. Tuesday is an election day, the statewide race on the ballot. That's next on Upfront.